kin, I just wish it were here 12 years ago. It's a one-shop stop. Everything's validated. We know it's factual. We know it's moderated. It's safe for patients, to the point where there's clinicians on there, there's patients on there, there's peer support on there. And if you've got a question, you can just type it up. This is there to do a service for kidney patients, and it's the best thing that I've ever seen. I mean, don't get me wrong, there's lots of useful information out there from Kidney Research UK, various kidney charities, but this puts us all within one umbrella. Instead of me going to this site, that site, this site, it's all in one place. We can all get together and ask the questions and request the information that you need, and I think it's the best thing that's ever happened.
The kin groups give you that network, that social aspect, that friendship group and peer group, which is really important to a lot of people. So for me, it's such an essential tool, because it's patients and patients' families in your area that are going through exactly what you've been going through. So I think it's such a good resource.
I think the kin is a useful hub of resources and support that is available, and they're genuinely doing a lot of work to make it accessible for people from all walks of life, and they've in a really good position to spread information. So as a carer, I think it's really useful to have access to that, because it can feel overwhelming or isolating to not have that information available. So I think it's a real useful resource and hub.
It creates a really safe environment for people to kind of discuss their issues, friends and family as well. And I think as a moderator, my job is to make sure that everybody is kind of safe and happy, and that if people need information, especially people that need information quickly, are signposted to the correct source. And that can just be people on the group, or it could be a clinician, or it could be a dietitian, etc. So it's about providing really good, secure information for people, so that they feel in touch with the community, but also they know where to go when they need help.
But to be able to have somebody who's almost like a whisper in your ear, who you can talk to in relation to having specific questions about your life, not your treatment necessarily, but about your life, it is so beneficial, and it's far better to know about it at the time than regret not knowing about it once it's happened.